Now, Doctor, your concerns go way beyond what the companies might or might not have to pay out. It gets back to doctors. Could you explain?
You know, Neil, and I think that this is an issue that involves lots of places and lots of people and lots of things, including doctors. I have to say, when I first heard the verdict, I was surprised, but I have to say pleasantly surprised, to be honest with you. And as a family doctor, what I want is I want us to look at all sides of the coin and really make right the wrongs that we have seen. That on the pharma side, but as you mentioned, on the doctor side. Doctors have a role in this too, in terms of how we prescribe opioids, if we're educating our patients, if we're prescribing them properly. But there are also other elements too, law enforcement, how we educate the public and patients, and other things. So this is it's a complex issue. It's not just one thing. But am I happy to see the direction that it seems that we're going? Yeah, I am.
You know, Doctor, the argument has been made that this is very similar to the tobacco crisis, some decades back, where we later learned that the tobacco companies were well aware of the addictive nature of their product, and these companies, the pharmaceutical companies, are well aware of the addictive nature of some of their products, and that they would push it as hard as they could. Did you ever discover that? Did you ever discover in dispensing of such medications, opioids now as they're known, that the company was really telling you, here you go, here you go, here you go?
Yeah, so, it's interesting. When I was coming up in medical school and residency, I literally came up in the era in the early 2000s where we were taught that pain is the fifth vital sign. I remember being on rounds in the hospital and literally being told to ask the patient, are they in pain? How much pain are they in? And to treat the pain. Now, do I remember pharmaceutical reps literally coming up to me saying, hey, prescribe this OxyContin, oxycodone? No, I don't have those experiences. But I did grow up in medicine at a time where literally I saw this huge insurgence of opioids being prescribed over and over and over by multiple medications. And now I'm on the other side of this. After 10, 15 years in this industry, I'm now seeing we're on the other side trying to say, wait a minute, hold up. This is not the right way to go. Doctors, we need to back up. Hey, let's look at the addictive nature of this. So while I didn't have personal experiences of pharmaceutical companies or coming up to me personally, I lived in that environment. I lived in that era where I saw more pain medications than I ever thought I actually would.
Interesting. Doctor, thank you for taking the time. Dr. Jen Caudle, a family physician, Brown University associate out of Philadelphia.